So when you're 81 years old and running for president, your health matters certainly a little more than most. So everyone is going to be waiting for the results of a routine checkup that the president received today at Walter Reed Medical Center. Biden was asked about the results last hour.
Straight away. Anything concerning that Americans should know about how your health? Well, they think I look too young. They think I look too young. No, there is something in the class. Everything's great. Everything's great.
Let's discuss the checkup and what the checkup entailed with Dr. F. Perry Wilson. He's an associate professor of medicine and public health at Yale University. He's also the author of How Medicine Works and When It Doesn't. Doctor, thank you so much for being with us. What do we usually learn from a presidential physical?
Well, they're quite thorough. It won't surprise you that they do a lot more for the president of the United States than you or I might get at our physical. Although all the usual stuff, the blood pressures and the height and weight will all be part of it. What Biden will also get is attention from a lot of different specialists. We know, for example, that he has atrial fibrillation, which is a common heart arrhythmia. So there will be cardiologists involved. He's had prior issues with skin cancers that needed to be removed or skin lesions that needed to be removed. So no doubt dermatologists will be involved as well. It's going to be quite a bit more thorough, or it was no doubt quite a bit more thorough than what a typical 81-year-old would get.
And so he's having this physical on the heels of having, of course, his mental acuity here in the news recently. There was a special counsel investigation about his handling of classified documents, which described his memory as poor. Is there going to be any sort of assessment of that kind of thing that will be part of the physical? And what will we learn or not learn from that?
Sure. Cognitive assessment is not a guideline recommended exam that should be performed in people who are of any age. It is not, the data says that, or the United States Preventive Services Task Force says there's insufficient data to recommend universal cognitive screening for older adults in the US. So he may not get any exam like that at all. That being said, patients can certainly request this, in which case there are a variety of cognitive exams that can be administered relatively quickly and are fairly accurate at predicting things like mild cognitive impairment, which is what you would see in an older person that doesn't actually rise to the level of dementia or anything like that. The most common tool for this is something called the Montreal Cognitive Assessment. We don't know whether he underwent any type of cognitive assessment. I can say that last year when this exam was done, there was no discussion of a cognitive assessment in the doctor's report.
And we just learned from the White House, literally as you were speaking, sir, that the White House doctors, or rather the president's doctors, officially decided that he does not need a cognitive test. Does that tell you anything specific about the president's mental acuity?
Well, not necessarily. As I said, cognitive testing is not a routine part of a normal checkup for an otherwise healthy 81-year-old. If there are symptoms or if the patient themselves is concerned that they're having difficulty, then certainly it can be performed. So we can look at this as saying, well, the White House doctors feel like, nope, we work with him every day. He seems fine. There's no need to do this. Of course, I think there's a political implication either way here, because you could imagine that if he went through it and passed with flying colors, that would probably do something to dispel some of the discussion about his age as in terms of his candidacy for president. But maybe there's some degree of risk there, right? If you're going to go through a rigorous cognitive assessment and you don't come out with a perfect 100%, what are the political implications there?
Yeah, no, it's a very good point. Dr. Wilson, great to have you. Thank you.
Anytime.